Prostate cancer is the most common non-skin cancer in America. Early detection is key. Sponsoring our segment this afternoon is Carle Health, and joining us now is Michelle Delorso, a nurse practitioner in urology at Carle Foundation Hospital. Welcome, Michelle.
Welcome, Ryan.
Tell us about prostate cancer. First off, let's just clarify, what is the prostate for those that might not know?
The prostate is a walnut-shaped gland that sits below the bladder in men. The purpose of it is to produce seminal fluid, and it transports sperm. The urethra, which is the tube that goes from the bladder to outside the body to drain urine, goes right through the prostate. Prostate cancer is detected oftentimes by a provider putting a gloved, lubricated finger in the rectum and trying to feel for any swelling or nodules. It is also detected by blood tests.
Got it. Now, I know, prostate cancer is something that I think all men eventually in life have to kind of get checked out, make sure they don't have it. It's very important. And as we mentioned earlier, detection is key. What are some of the risk factors that folks should be aware of?
Well, some of the risk factors, as with any cancer, the sooner we detect it, the lower the risk factors are. Some people detected early may have few or no symptoms, but if they do have symptoms, it could be things like urinary frequency, hesitancy of being able to starting urination, burning with urination. We see erectile dysfunction. We can also see low back pain, hip pain, and pain in the upper thighs.
So really just being aware of your body.
Correct.
When things are not as they used to be.
Absolutely.
It's probably time to start paying attention, maybe mention something to your doctor.
Correct.
What about the complicating factors when it comes to prostate cancer?
So complicating factors, again, erectile dysfunction can be a symptom of the cancer, but it also can be a side effect of cancer treatment. Prostate cancer can also spread to other areas of the body, including bladder, bones, and the lymphatic system. If that happens, it can be controlled, but less likely to be cured.
Got it.
Again, early detection.
Early detection. It's, it's funny because a lot of times we don't want to talk about things like this.
Correct.
We don't want to look because maybe if we don't look, we won't know, and it's not true, right? But
Absolutely.
that's just not reality, and so we can end up with bigger problems down the road.
Correct.
If we don't actually pay attention.
Yes.
Now, what can men do in the meantime to reduce the risk?
Obviously, early detection, which is what we're discussing today. So the American Urological Association has put out new guidelines for prostate cancer screening. They recommend a baseline PSA or blood test to be done between ages 40 and 45. This is a one-time test. We recommend routine screening for men starting at age 50 to 70 every 2 to 4 years if they don't have high risk factors. If they have high risk factors, which include race, unfortunately, black men, obesity, obese men for unknown reasons have higher risks of prostate cancer. Age. We do know that as men age, the risk for prostate cancer goes up. And then obviously, family history is the biggest one.
So if your father, uncle, grandfather.
Really, we talk about father, sibling, and child.
Father, sibling, and child.
Correct.
Okay.
Those put you at a much higher risk for prostate cancer.
So if it's in the family,
definitely
better
keep
start
an eye
getting
on
checked.
things. Other things you can do is a good diet. So eating a diet high in fruits and vegetables. We recommend getting your vitamins and supplements from your food rather than supplements if possible.
The natural way.
Correct. And then movement and exercise most days of the week. So.
Awesome. All very, very important things. And it seems like the lesson of the day is early detection, early detection, early detection.
Absolutely.
All right. Well, thank you so much for joining us today, Michelle.
Thank you, Ryan.
To learn more, we're going to connect you with Carle, who we appreciate sponsoring our segment today at our website after today's show.